Unless you have a serious injury or illness, a visit to accident and emergency can involve a long wait to be seen. And in the winter months, you may wait even longer, as too many people turn up with comparatively trivial complaints that could be treated outside of A&E. But there is an alternative to a visit to casualty. NHS Local has been to a new walk-in centre in Sandwell that's helping to reduce the burden on A&E departments by providing healthcare and advice to people so that they get the most appropriate treatment and quickly. When emergency medical care is needed, calling 999 or visiting the local A&E department is usually the first port of call. But there is an alternative. People with less serious conditions can receive quicker, more suitable treatment using alternatives, such as a local walk-in centre, like this one in West Bromwich.
People do need to understand more about what a walk-in centre is useful for. We tend to treat the non-life-threatening illnesses, so sore throat, urine infections, simple lacerations, minor injuries such as sprains, strains, and these tend to be patients who traditionally would have gone to A&E. And just have a listen to belly as well, okay?
The centre has a dedicated team of GPs and nurses on hand every day of the year. Many of the patients treated here are referred by the ambulance service after calling 999.
We see what's called Category C ambulance patients, so they're patients who have phoned the emergency services, 999, for an ambulance, but their condition is deemed not to require immediate treatment at an A&E department, and that they would be better off being seen at a GP-led health centre.
The walk-in centre is very important because it saves time in the main for people, for the general public. It saves them waiting in A&E for hours upon hours for something that's relatively minor, and the patients are triaged pretty quickly and we can get them sorted quite quickly, really. It reduces the pressure on the general hospitals and the A&E department.
If any pain or anything, you ask me to stop, eh?
Yeah. Okay.
Well, I promise you're gonna be fine.
A&E is really there for proper accidents and emergencies, and most of the patients actually are happy to be seen by a more appropriate service and actually in a place that has a reduced waiting time than they would need to wait if they were in A&E.
With opening hours from 8 a.m. till 8 p.m, the centre is also handy for patients who want to drop in out of normal office hours.
What we try to do is to provide access to patients who are unable to be seen by their own GP practice. Some of these people actually, because of work, they're unable to visit their doctor within hours, so they may need to see a doctor early in the morning or late in the evening, all of the weekends as well.
Of course, it's for my daughter.
In the winter, there's a significant increase in demand for emergency medical services, and walk-in centres like this one are helping reduce the pressure.
In the winter we do get an increased number of people coming through the doors. Colds, flu, asthma conditions are exacerbated during the winter, so we get more problems with the asthma patients. We see an increase in minor cuts and bruises and falls.
We do find that all services have additional winter pressures, and all these conditions actually are better treated by a general practice rather than going to accident and emergency.
West Bromwich's facility is just one of a number of alternatives to calling 999 for treating minor conditions this winter, allowing patients to receive the care they need when they need it.
I really enjoy treating the patients, and I think the people of Sandwell are great, and it's a really rewarding job, and I think I'm really lucky because of the people that I work with as well.
I really enjoy it, yeah. It's fast-paced, it's very rewarding, you get results, and 9 times out of 10 people are very happy with the service.